Hello, Miss Chaudhary. Is it summer yet completely on your end, or how is the weather?
It's a lovely spring day in the UK today. A large part of the UK has we have a lovely spring day.
See, the weather is fluctuating a bit, so so many of us are catching the weather. Anyways, let us take a few seconds for our audience to join. It does appear that there are some folks who are joining. So, good evening, everyone, and welcome to the Persecution Report. I'm your host, Anwar Sadar Jihan. Tonight's episode carries a title that should stop all of us cold. Children are dying. What happened to Bangladesh's healthcare miracle? Now, tonight's episode is not any hypothetical. It's not any projection. Children, real children, are dying as we speak. As you are watching this, children are lying on hospital corridors, on floors, and in front of lifts. Why? Because there are no beds available. As the Prime Minister of Bangladesh, Mr. Tariq Rahman, is busy enjoying a movie. He is busy enjoying a movie. Real children, real children are dying. They are dying from measles, a disease that Bangladesh had nearly eliminated. Let that sink in. What happened to Bangladesh? A disease that Bangladesh nearly had eliminated. What it appears is that what Bangladesh is going through is nothing but a cascading catastrophic breakdown. It is a complete breakdown, and it did not happen by any accident. Bangladesh's healthcare story was one of the greatest development stories of the world. If you take a look, the Lancet, one of world's most prestigious medical journal, dedicated a full series to what it's called the Bangladesh paradox back in 2013. That means incredible, phenomenal healthcare achievements despite economic limitations. But then what happened? Why the children are suffering today? Who dismantled the healthcare system of Bangladesh? Bangladesh built a healthcare success stories through tremendous hard work. Over 50 years, the child mortality rate in Bangladesh fell down by nearly 90%. A woman who once had 1 in 4 chance of losing her children before the age of 5 was living in a country that the United Nations recognized as a role model. Then what happened? The unthinkable happened. August 2024, the democratically elected Bangladesh Awami League government was ousted. An interim government took over, and within 18 months, measles outbreak spread 56 districts out of the 64 districts of Bangladesh. 114 children are dead. 114 as we are speaking. As we are speaking, the number may be even rising. So why is that? Here's what we are going to do tonight. We're going to show you what was built in the healthcare system in Bangladesh and who built it. Then, what was dismantled and who dismantled it. And lastly, and most importantly, we are going to ask who is accountable. Because when children are dying from a disease that is preventable, accountability is not merely a political action, it is a moral act. And to discuss this critical issue, tonight I'm honored to be joined by three people who collectively represent the best, the very best that Bangladesh has to offer. Dr. Raihan Jamil, a scholar and researcher of Health Equity and Justice Department of the University of Albany, and Ms. Jasmine Chaudhary, a healthcare professional and a public representative from the United Kingdom. And last but not the least, Mr. Saifur Rahman, who is an avid follower of governance of the information sphere, who will help us tonight to connect the dots. So let us begin with Dr. Raihan Jamil, who is going to present before us a slideshow that will tell us about the overall picture of what is happening. To you, Dr. Jamil.
Thank you, Jihan. Thank you for giving me the floor. I would like to welcome everyone who is watching us live and hopefully will be watching us later on the recording. Let me see if I can share my presentation. Give me one moment, please. Can you all see my screen properly?
Yes, Dr. Jamil. I mean,
Okay,
as long as it is fine with you, I am just seeing the screen but not you.
Correct, that's
everything is fine with you. Okay.
let the focus be on the content.
Okay.
So shall I begin?
Yeah, sure.
Excellent. Tonight, we're talking about something that should outrage everyone, every Bangladeshi at least, and every human being who believes children's lives matter the most. So what we're going to talk about today is this. We're going to start with where Bangladesh came from. We look at what was built, and then we look at who destroyed it and what that destruction has cost, similar to what our host Jihan was sharing earlier. In 1971, 1 in 4 children, just think about it for a moment, 1 in 4 children born in Bangladesh died before their 5th birthday. 1 in 4. That was where we started. Many called us the basket case. Was that really the issue? When Bangladesh was born in 1971, our life expectancy was just 47 years. We had only one doctor for every 11,000 people. One doctor for 11,000 plus people. And immunization was virtually non-existent at 2%. Henry Kissinger supposedly called us an international basket case, although it's debatable, but he was definitely wrong. The child mortality chart that I'm going to share with now is this. Look at this chart. From 251 deaths per 1,000 in 1971, right? In 1971, came down to just 31 by 2021. That's miraculous. A 90% decline in 50 years. That did not happen by accident, ladies and gentlemen. It happened because of political will, sustained investment, and the government that treated healthcare as a right, not a privilege. And life expectancy, which was at 47 years in 1971, came to 74 years by 2019. A generation was gained. The Lancet called it extraordinary. The world took notice. And this is what the Lancet famously termed as the Bangladesh paradox. In 2013, the Lancet, which is one of the world's most respected medical journals, wrote about what it called the Bangladesh paradox. Exceptional health achievement despite economic poverty. Think about it. Despite economic poverty, we achieved an exceptional health achievement. That was us. We were the model. Sheikh Hasina started this in 1998. Over 14,000 community clinics were established. 490,000 people were served every single day. Free medicines, care at your doorstep. This was Prime Minister Sheikh Hasina's vision, and it worked. And as a result of that, in May 2023, the United Nations unanimously passed a resolution co-sponsored by all 70 nations, and they recognized this model as the Sheikh Hasina Initiative. It was unanimously adopted by the United Nations General Assembly, and 70 countries said this, ladies and gentlemen, the world should learn from Bangladesh. And then COVID-19 hit, right? Bangladesh delivered 270 million doses free for everyone. No country of comparable size and income did it better than us, Bangladesh. Now, 80% were fully vaccinated by June 2022. Just 29 cents cost us in terms of US dollar per dose. And that is the lowest of any comparable country on earth. Launched in January 27, 2021, among the first 35 nations globally. And Bangladesh became the single largest recipient of the COVAX vaccines anywhere in the world. Gavi called it a global success story. UNICEF called it a vaccination success story. So we should be proud of these achievements. Those same 14,000 clinics delivered it. How did we reach those remote villages, river islands, and hill tracts? We know because of the clinics that were established by Prime Minister Sheikh Hasina in 1998. Health workers took both if needed. They trekked through fields. They did it because our system worked. And then August 2024 happened. Muhammad Yunus usurped power. And his first act on healthcare, ladies and gentlemen, was to cancel the 25-year of infrastructure. No reform, not reform, just cancel it. So 25 years gone. The BD Dias investigation revealed what happened behind the scenes. The Bangladesh National Health Backbone, which is the HPNSP, was scrapped. There was no replacement for it. There was no plan for it. Just gone. So what stopped? Here is what stopped the day our national health plan, the HPNSP, was cancelled. Vaccines for 14,500 clinics stopped. Medicines at 430 hospitals stopped. Food for malnourished newborns stopped. Vitamin A campaigns stopped. Ambulance maintenance stopped. And over 25,000 health workers' jobs were lost or was at risk. Everything, ladies and gentlemen, Muhammad Yunus was bent on destroying it. in one decision. We had zero drug procurement, zero. Not a single drug procurement was ordered for nearly a full year, from July 2024 to May 2025. The medicine simply stopped coming. Then what we saw was the Health Services Division spent just 2.34%, so basically barely 2% of its development budget in 10 months. 2.34%. Dead last among all government ministries. This is what abandonment looks like. BT Digest reported what the government would not admit. Yunus planned to hand the free vaccination program over to NGOs for profit. Children's vaccines for profit. And in the last several months, we have seen how we have actually lost more than 50 children. The current number as of today is about 114 plus children has died from measles in a country that had nearly eliminated measles, that Jihan pointed out earlier as well. 56 of the 64 districts were affected. This is not a local crisis, ladies and gentlemen. This is a national emergency. We had a 75 times surge in the measles cases. In the same period last year, we had only 9 cases. In 2024, 64. This year, 676. That's crazy. It's a 75-fold increase in 1 year. In 1 year, while the government just watched. Even Prothom Alo, one of Bangladesh's most widely read newspapers, reported the World Health Organization's deep concern. The WHO said the immunity gap created by the Yunus administration's negligence is the primary cause of this outbreak. This is not a coincidence, ladies and gentlemen. This did not happen by accident. Step by step, our National Health Plan, the HPNSP, was cancelled in June 2024. Vaccine stocks depleted. The measles campaign that was due was never held. Health workers went on strike 3 times. Vaccination was suspended each time. The central warehouse ran out and 50 plus children died. Every step a consequence of a decision. This did not happen by accident. Then came the second blow. President Trump of the United States cut 97% of Bangladesh's bilateral US health funding from $80 million to just $2 million. Bangladesh was the country with the largest percentage cut in the entire world. Yunus had already dismantled the safety net before President Trump pulled the rug. So when the cuts came, there was nothing underneath, no backup plan, no buffer, no contingency plan, just a free fall. And children paid with their lives. And now the BNP is back. Remember, BNP shut every one of those 14,000 plus community clinics when they came to power in 2001. Not because the clinics are failing, ladies and gentlemen. You will be shocked and surprised. BNP shut down all those clinics because they were working. And the idea behind that was, if people were getting helped by these clinics, people will come and vote for Awami League. That was their reasoning. Extortion. And now the man leading Bangladesh is Prime Minister Tariq Rahman. He is convicted of...
Prime Minister Tariq Rahman, as you are seeing, whom Dr. Jamil, we are Mr. Tariq Rahman. We are seeing him.
Indeed. Like that is what his designation is right now, whether we like it or not. But look at who he is. He is convicted of money laundering by the Bangladesh's highest court, the High Court. An FBI agent physically came to Bangladesh and testified against him. The American embassy called him, and I'm using their exact words, a symbol of kleptocratic government. A symbol of kleptocratic government. That's what Tariq Rahman represents. His convictions were conveniently overturned by the Jamaat Yunus regime. His coalition partner is who? Jamaat-e Islami, the party that sided with
So as we are talking about Tariq Rahman and seeing him as Mr. Tariq Rahman being completely busy watching and enjoying a movie, right? When real children are dying, Mr. Tariq Rahman is busy enjoying a movie. Crisis happens. I mean, we all work in professional world, and in professional world, system fails. Things can go wrong. Things go wrong, but then we have leaders who take charge, right? But that's what is absent in Bangladesh right now. And with that, right now, I would like to go to Ms. Chaudhuri, who works in the public health care of the United Kingdom and who has seen it all. So, Ms. Chaudhuri, you work in the public health in the United Kingdom, right? You have seen strong systems. Also, you have seen what happens when systems are deliberately starved of resources. Systems can't function, right? So when you look at what's happening right now in Bangladesh, more than 114 children dead from measles, a disease that we have the ability to prevent. 56 districts affected. Children don't have bed in the hospital. As a healthcare professional, what is your first reaction? To you, Ms. Chaudhuri.
Thank you, Mr. Jihan. Thank you for including me in this conversation today. My first reaction as a mother, as a professional who has worked in the fields of public health and social justice for over 2 decades now, and as a human being, is one of grief. Because we all know what these numbers mean. Behind every statistic, it's a loss of an innocent child. This is what we are talking about. And behind every child, there's the helplessness, the loss of hopes and dreams of a family, the hopes and dreams of a nation, and the kind of world, the better world we all want to build. So I keep thinking about Nazim Hikmet's line, let's give the world to the children. I keep thinking of the mother who carried her baby to a hospital and was told there are no beds. I keep thinking of the father who watched his child fight the disease that should have been prevented by a vaccine that is simply not, at least he's being told, is not available. So these, this is what leads me to feel this is my first reaction, is one of sheer grief. We all know measles is one of the most contagious diseases known to humanity. Once infected, a person can pass it on to up to 18 others. It's a serious airborne disease caused by a virus that can lead to severe complications, such as destroying a child's immune system for months, leaving them wide open to other infectious diseases. And as we are tragically witnessing in the case of Bangladesh right now, it can lead to fatalities. So we know this. The science has been settled for a long time. The only thing standing between a child and measles is a safe and cost-effective vaccine, the MMR vaccine. We also know that measles vaccination, the MMR vaccination, averts millions of deaths every year across the globe. So according to the World Health Organization, it averted 59 million deaths between 2020 and 2024 across the world. So when I hear, and as we heard Dr. Jamil just go through those statistics, the the progress, the miracle Bangladesh had in the health sector. And now I hear that the central vaccine warehouse in Bangladesh had zero stock.
Let me stop you for a second here, Ms. Chaudhary. What I would like from you is that you focus. You are a mother, right? You are a mother. You have children. So these are real children that are dying. So as a mother, what are your take? These could be your children, right? So going beyond the statistics and all that. As a mother, what is your take? What Mr. Tariq Rahman is doing?
It's one of that I find difficult to describe as a human being, as a mother, as a professional working in public health. And when we talk about sort of empty vaccine warehouse, and we know this is not due to any accident, this is not due to any bad luck, this is not a disruption in the supply chain. This is a failure, a sheer failure in policy. It's a systemic failure. A government, in my view, I'm struggling to find the right words to describe how upsetting this feels as a mum, again, as a mother and a professional working in public health. It's a government that made those decisions, conscious and deliberate decisions, that emptied those warehouses, which is now leading to all those deaths of innocent children. The Yunus administration cancelled the 5th Health, Population and Nutrition Health Programme. The programme was the backbone of the vaccine procurement in Bangladesh for over 25 years. And we saw in Dr. Jamil's presentation how effective that program was, and how many lives it's saved over the years, over the 25 years. So they cancelled it without a replacement plan, and there was nothing in place to prevent all these deaths that we are now witnessing. I mean, it's far from perfect in the UK, but when we talk about health equity in general, we talk about social and wider determinants of health. So the condition in which people are born in, they grow up in, live and age in. We emphasize on tailoring interventions, public health interventions and services to the greatest needs of different population groups based on the barriers and the facilitators they face. So the community clinic model that Sheikh Hasina had built, as we have heard, was a textbook example of addressing those wider social determinants of health. You put care where people are. It's as simple as that. You remove those barriers of distance, of cost, of having to travel for hours to a city hospital. And it was the fundamental principle that we know Bangabandhu Sheikh Mujibur Rahman held very close to his heart. It's about the protection of the most vulnerable in our communities. And this is behind what Sheikh Hasina had introduced through those community clinics. 490,000 people a day were served by those clinics. And now we are hearing about how the medicines have run out, how vaccines have run out for nearly a year. From July 2024 to May 25, no drugs were procured, not a single procurement order. As a public health practitioner, I simply find this unconscionable. And as a human being, I frankly find it inhumane.
Thank you, Ms. Chaudhary. So you have talked about some stuff about the failure of the Yunus government. Now there are some folks, there are some people who will go ahead and say that, hey, this Yunus government was just a transitional government. They were an interim government. Why does it matter? They were just there to reform it. But now, Ms. Chaudhary, I have to be honest. I have really zero patience for this argument. because these are real children. For example, if in my workplace where I design and work with airplanes, we don't remove a critical safety system and then figure out the replacement later. We first know what will be the replacement. Otherwise, people's life will be gone. Now, with that, I would like to come to Mr. Rahman, Saifur Rahman, who is a very, very renowned face in our younger crowd. He is a Pro 71 blogger. He has been since the early days, who follows governance and information landscape very closely. So I would like to come to you, Mr. Rahman, as somebody who watches the governance and also follows the information landscape closely. From your perspective, the failure in containing this measles outbreak, especially after the success that Awami League government achieved, what does it say about a government's priority and its capacity? To you, Mr. Rahman.
Thank you, Jihan, and thank you, the other panelists we have today. Before going to your question, I would like to thank you especially, Mr. Jamil, who has taken us through how Bangladesh has achieved a tremendous success over the years. It is actually, that's the real thing that had been like eliminating the discrimination we call in the society. So it was like that 2 years back. But again, and I want to start exactly where you left off, because of COVID. Contrast is not a footnote, it is the whole story. Let us remember what Bangladesh actually did during COVID. We are talking about a low middle income country of 170 million people, high population density, a fragile health system, and a global pandemic hitting simultaneously. And what did Sheikh Hasina do? She moved immediately. She allocated funds the moment the first patient was identified. If you remember, she signed a bilateral vaccine agreements before most governments had even drawn up a plan. She joined COVAX very early, and she made a public commitment: every vaccine will be free. Not only for the wealthy, not for the connected, but for everyone. Now, what was the result? Bangladesh launched its COVID vaccination drive on January 27, 2021, among the first 35 countries in the world to do so. By June 2021, only 4% of Bangladeshis had 2 doses. 18 months later, what we have seen that the number was nearly 80%. Gavi, which is the world's leading vaccine alliance, called it a global success story. It's not only nationwide, it was a global success story among all the countries in the world. UNICEF called it a vaccine success story. Bangladesh became the largest recipient of COVID vaccines through COVAX on earth. 270 million doses. Remember this number, 270 million doses, at a delivery cost of just 29 cents per dose, the lowest of any comparable country studied. And here is a part that connects directly to tonight's crisis, or what we are seeing, what we are observing at the moment in Bangladesh. The delivery mechanism for those COVID vaccines in rural Bangladesh was the community clinic network. the same 14,500 clinics now starved of medicine. They worked during a global pandemic. They reached remote areas, river islands, hill tracks. Health workers transported those vaccines on boats. They trekked through fields. They did it because the system was funded, coordinated, and led with a proper political will. Now, fast forward. What did the Yunus administration had done in last 18 months? The Yunus administration arrives, and what do they do with the same infrastructure? They cancel the funding program, they freeze procurement, they let 25,000 health workers face the prospect of losing their jobs. The health services division spent just 2.34% of its development budget in 10 months. The worst performer of all government ministries. And the central vaccine warehouse ran out of measles vaccines while children are dying. That is the contrast. 270 million COVID doses delivered, zero measles vaccines in stock. Same country, same clinics, same people. One government built, the next just destroyed. And as someone who watches the information space, I can tell you this collapse was entirely predictable. People were warning about it. The warnings were ignored, and now you see children are dying. Over to you, Mr. Jan.
Real children are dying as we are talking. And this is the same government, same country, same infrastructure, same logistics, same everything. One government, Prime Minister Sheikh Hasina, tried to take the country forward, and the other government is trying to take the country back. As Prime Minister Tariq Rahman also very confidently said, take back Bangladesh. He is taking it back to 2001 and 2006. Now with that, I would like to come back to Dr. Rahan Jamil. Dr. Rahan Jamil, you have spent your career studying health communication and health equity. Now, I would like to bring your perspective here, not merely as a researcher or as a scholar, but as someone who grew up in Bangladesh and who understands what healthcare success means for the ordinary people. For example, a lady in Rangpur or a farmer in Kumilla. What does the healthcare success stories of Bangladesh mean for them? And when those success evaporates, how does that affect them? To you, Dr. Chan.
Thank you, Jian, for the question. This question hits close to home for me because when we talk about the health systems in academic papers, and I have written several, we use words like infrastructure and coverage and outcome indicators. And those words can make it feel abstract. So let me make it concrete for our audience. In 1971, when Bangladesh was born from the ashes of the genocide that killed 3 million, took 3 million lives, a child born in Bangladeshi village had a 1 in 4 chance of dying before their 5th birthday. And several of our panelists talked about it. Ms. Chaudhry did, Mr. Rahman did, and you briefly touched about it. Think about that in human terms. A woman who gives birth, and statistically, she's looking at a coin flip played twice. 1 of her 4 children will likely not survive. That was the reality. Then something extraordinary happened. Bangladesh built slowly, painstakingly, over 5 decades, it built a system that reached into those villages. Prime Minister Sheikh Hasina's community clinic model, which, like we have talked about before, how the UN unanimously recognized in 2023, was the backbone of all of this. It meant that instead of traveling 3 hours to a hospital, like Ms. Chaudhary was saying, you could walk 20 minutes to a clinic. Instead of paying money to get medicines, you did not have to pay for them, get for free. You could get 30 types of medicines for free, not just one. That instead of giving birth with no trained person present, there was someone there who knew what to do. Now, when I did my research on rural health in Bangladesh, and I published many of those papers in Health Communication and other journals on this, what I heard over and over from people at the margins was not just gratitude for the services, it was dignity. For the first time, the government was coming to them, not the other way around. That matters. In health communication, we talk about the patient-provider relationships. But before you even get to that relationship, you have to have access. Prime Minister Sheikh Hasina built that access. And like Ms. Chaudhary was mentioning earlier, over 500,000 people visited those clinics every single day. Now imagine that access disappearing. The medicines running out, the vaccines not coming, the ambulance is not working because there's no money to keep them running. A woman in Rangpur, or the one in Gopalganj, for the example that you're talking about, that was also reported in the BD Digest investigation. Her baby was born overweight, and she went to the hospital and they told her that there was no food. No F100, no F70, the therapeutic foods that keep malnourished newborns alive. Her baby was underweight and the government had no food for that baby. You asked earlier to Ms. Chaudhary about her being a mom and how it makes her feel. Think about it as a father. Think about it as a parent. Think about it as a human being. That is what we have allowed to happen. As a health education scholar, I study how people receive and act on health information. But right now in Bangladesh, the message that the most vulnerable people are receiving is this: you do not matter. And that is a message that kills. Back to you.
So the Bangladeshis do not matter because the Prime Minister is busy enjoying a movie, right? The children that are lying on the floor, they do not matter. This is the reality in Bangladesh right now. With that, I would like to again bring back Ms. Chaudhary to the discussion and bring back one important aspect, because Bangladesh has experienced massive foreign aid cut in the health sector, especially USAID. When President Trump took over power in the United States, he dismantled USAID, and it effectively dismantled 97% of the bilateral US funding that Bangladesh used to receive. It dropped from nearly 80 million to just 2 million in 2025. Now, what President Trump is going to do, Bangladeshi Prime Minister or Bangladeshi President cannot control, or no country can control. But how the country responds show us about the country's character, the government's character. Ms. Chaudhary, as somebody who worked effectively in the healthcare of a developed world, what do you think? What does this double blow mean to Bangladesh, and how should have a competent government responded in your eye?
Thank you. Really important question. It's important because I believe that we do have to be fair, equitable, but it's equally important to be honest at the same time. So you're right. President Trump's cuts were not UNICEF's fault, but here's the critical point. A competent government with a functioning health ministry would have been able to absorb a shock like this, or at least mitigate it. So because it would have the systems in place, buffer stocks, contingency plans, relationships with alternative donors, it would be able to cope with shocks like this. The HBNSP, had it continued, would have provided the structural scaffolding to weather that storm. Instead, UNIS had already dismantled that scaffolding, and it actually happened 6 months before the US aid cuts. They came through. So when Trump actually pulled that rug, there was nothing underneath. There was no net. It was just a free fall. And what did that mean in practice? USAID had been protecting 2.3 million children against diphtheria, measles, polio, tetanus. Those programs, those vital programs, came to this halt. They stopped. The ICDDRB, one of the world's most respected disease research institution, the institution that pioneered oral rehydration therapy, which has saved over 50 million lives globally. That institution's TV screening program, which had screened 52 million people and found 148,000 TB cases, including 18,000 children, that program was shut down. Bangladesh had cut TB deaths from 81,000 a year in 2010 to 44,000 a year in 2023. That's a remarkable success in terms of death due to TB. That hard-won progress is now at risk. And there is another thing I want to say. As a woman working in public health, the UN Population Fund, the UNFPA, was running reproductive and maternal health programs in Bangladesh with US support. When that support was pulled and when these programs were shut down, midwives were not paid, clinics were shutting down, and the UNFPA country director said something that has stayed with me since then. They said the risk of babies and mothers dying had shot up. So not increased slightly, they had shot up. That is the combination of UNICEF's negligence and Trump's cruelty. This is what it did to Bangladesh's women and to its children. Back to you.
Thank you, Ms. Jasmine. Now, I would not go about President Trump's action or inaction or his cruelty or not, but what it appears to me is that Mr. Yunus could care less about the life of the children of Bangladesh. Because, as we all know, Mr. Yunus is a character who is only about himself. He has been historically only about himself and his empire. With that, now I would like to come back to Mr. Rahman. Mr. Rahman, as somebody in the information sphere and following the information war waged against us very closely, you have seen that BMP has been in power before. We have seen BMP. We have seen BMP between 2001 and 2006, right? Mr. Tariq Rahman, his mother, Begum Khaleda Jia, was prime minister back then. But what they did, they shut down Prime Minister Sheikh Hasina's community clinics out of pure political spite, simply not because they were not working, but because they were working. Because they were working, they were pissed about it. After how Sheikh Hasina handled COVID brilliantly, the pandemic brilliantly, using the same clinics, Mr. Rahman, now that BMP is back, what can we expect from BMP? Or like, what is the path going forward from here? To you.
Thank you, Jihan. Firstly, I would like to add one thing, that is, healthcare system in a country is not or cannot be built overnight. It takes time. And if you just withdraw a system, you even cannot withdraw it overnight. You have to have a proper plan. That's I would like to start with. But here, I would like to also connect everything we have talked about tonight because it tells one coherent story. Sheikh Hasina built the community clinic network starting in 1998. BNP came to power in 2001 and shut them all down overnight. Not because the clinics were failing. Remember, the clinics were doing extremely good. They had a 70% success rate. Can you imagine? 70% success rate. BNP shut them because they were afraid the beneficiaries would vote Awami League next time. As Sheikh Hasina herself said, they denied healthcare to people out of electoral calculation. That is extortion, not governance. Then what we have seen, Hasina came back in 2009. She rebuilt those clinics, expanded them to over 14,000. And when COVID hit, those same clinics became the backbone of one of the most successful vaccination drives in the developing world. Health workers took boats across rivers. They trekked through fields. They delivered, as I said earlier, 270 million doses in a country where the infrastructure should not have been able to do it. But it did because of, as I said even earlier, a very true political will and a system that had been built with care over decades. Now look at what is happening online. As someone who watches the information space, I can tell you that the BNP Jamaat ecosystem has spent years trying to erase that legacy, discrediting the community clinics, spreading misinformation about the healthcare under Hasina. And now that they're in power, the erasure is no longer just online, it is now structural. The HPNSP is gone, the procurement is frozen, and Tariq Rahman, a man convicted of money laundering by the High Court, with an FBI agent testifying against him in Dhaka courtroom, is now Prime Minister of Bangladesh. His convictions were overturned by courts shaped by the same interim government that let children die of measles. As you asked, what I expect going forward, I expect the politicization of every health appointment. I expect medicine procurement contracts going to BNP connected suppliers. I expect the community clinic to be used as political tools, open in BNP areas, neglected in others. And I expect a continued information war where any criticism of the collapse is labeled as Awami League propaganda and where the deaths of children become statistics to be managed rather than tragedies to be prevented. History rhymes, Jahan. In 1971, the war criminals tried to erase Bengali identity. Today, their political descendants are erasing Bangladesh's greatest public health legacy. Different tools, same instinct. Back to you, Jihan.
Thank you, Mr. Rahman. You have mentioned some very important things. Again, I would like to bring my audience back to the fact that a prime minister of country, when children are dying, more than 6,000 children are affected, when there is no vaccine, when ambulance cannot move because ambulance does not have the money to provide fuel. The prime minister of the country is busy watching a movie. I would like to request all my audience to comprehend this scene. The Prime Minister of that country is busy enjoying a movie when real children are dying. And we are also seeing the international community not doing what it needs to do. Now, as somebody, Ms. Chaudhary, who works in the healthcare field, who also engages with the international community, the diaspora, why the international community is silent? What the international community should do? Because the life of these children matters. All the lives matter. What this international community should do and what the diaspora should do. To you, Mr.
Thank you, Jihan. The silence of the international community on the measles outbreak in Bangladesh has been very concerning. And let me be frank, quite often higher profile crises such as war, climate disasters, pandemic, they can often grab the whole attention of the media and the global focus, as it were. So when we see outbreaks in lower income countries, often receives less sustained international attention, and they pose, unless they pose a direct threat to the wealthier nations, this perspective can be described as quite short-sighted, actually, because as infectious diseases can quickly become global problems if left unchecked. So on the contrary, we have seen how when Sri Lanka, for example, had its economic and political crisis in 2022, the Global Fund approved the emergency health funding within weeks. When there are outbreaks in African nations, the World Health Organization mobilizes rapidly and publicly. But in the case of Bangladesh, a country that was held up as a global model just 2 years ago, is now watching itself, sort of the health system totally coming, collapsing in front of our eyes. The international response has been cautious at best and invisible at worst. So part of this is political. The Yunus government enjoyed enormous goodwill internationally when it first took power. Governments had for whatever reason, had grown frustrated with Sheikh Hasina's administration, were relieved to see a change, and there is a reluctance to publicly criticize a Nobel laureate. But goodwill is not a substitute for accountability, and children dying of measles do not care about diplomatic sensitivities. So we should be holding the international community to be accountable. And what we should be asking the global world to respond to this public health crisis in Bangladesh. So how can they respond? So first, WHO and UNICEF need to be far more vocal. They have the data, they have the evidence, they have expressed concerns privately. That concern needs to become public pressure globally. Second, the international donors need to condition future support to the restoration of a functioning health sector program, not just emergency vaccine procurement. We need to see a sustainable framework to rebuild Bangladesh's health infrastructure. And third, the global public health community, researchers, journalists, institutions need to be writing about Bangladesh the way they wrote in 2013, as we heard previously in the Lancet, where the miracle in Bangladesh was celebrated. They need to write about this collapse of the system over the last 20 months. And so they need to do that with the same rigor and with the same sense of emergency. The world helped Bangladesh to build its miracle. The world has a responsibility to speak when that miracle is being destroyed right in front of our eyes.
Thank you, Ms. Chaudhary. So, from today's discussion, what I have understood and what I'm sure that my audiences are also taking is that it was only Mr. Yunus and his interim government's negligence that are solely responsible for the death of all these innocent children. Because they did not care, now we are losing all these children. But where do we go? This is the question Taslima Begum, the mother who lost a child, asked. It is a question every parent in rural Bangladesh today who cannot get medicine, who cannot find a vaccine, cannot get an ambulance, is asking tonight. We started this conversation with a number, 114 children dead, but we are ending tonight with a name, Taslima Begum. Because this is what empathy demands of us. These are not only numbers, these are real people, these are real individuals, and these are real lives. Tonight, we heard from 3 people. I'm proud to call my colleagues and my friends. Jasmine told us that children are dying not because Bangladesh is poor, but because Bangladesh's government, UNO's government, chose them to die. Mr. Rahman Mishu Bhai told us to connect the dot, told us to see PMP Jamaat for exactly what they are, anti-Bangladesh. History told us that. The present scenario is telling us that. And last but not least, Dr. Raihan, who reminded us that a blueprint for recovery exists because the Awami League chief, Prime Minister Sheikh Hasina, built something real. She built something that the 70 countries of the world recognized, something that worked even through the greatest pandemic, the China virus, the COVID pandemic. I want to add one more final thing. As an engineer, I know that our system under stress does not always fail at once. It fails one component at a time. In Bangladesh healthcare system, something like that is happening. One component is failing after another. But it is us, it is all of you who can wake up, who can demand accountability, which can prevent the loss of all these children. We are not yet at a total collapse, but we are close enough that every day matters, every voice matters, every episode of this persecution report matters. Thank you to Ms. Chaudhuri, Mr. Rahman, and Mr. Dr. Rahan Jamil for being here today and sharing your perspective. And thank you for our audience for watching, for sharing, and for caring. Please share this episode with your friends because the more people know, the harder it is for the authority to look away. From the persecution report, I am Anwar Sadat Jihan. Stay well, stay safe. Thank you. Jai Bangla.